a very high income, because when we put them all together, we're looking at people with problems. So I consider my term or my leadership in office as being people connected. I have always looked at real problems and tried to find solutions to address the problems that I have found occurring. And when people come to me about a situation, I always try to look at it in a holistic point of view, look at it as being what is causing these problems to exist. What can we do to alleviate those problems, and how we can make the problem better or eradicate the problem itself. And so that has spearheaded many of the legislation that I have tried to address. One piece of legislation that I think that have addressed an issue, and that is in the health-related fields. And the first piece is a catastrophic fundraising bill. With that bill, what you are doing is you're putting in place a mechanism to raise money for an organ transplant, to raise money when someone has a serious illness that they can't pay for, and you are out collecting money. Well, how do we know the money is going to get to the individual with whom it is raised for? So what I did was put in place a bill that says that the beneficiary should be the individual's name that should be on the bank account. And then we're looking at banks, matter of fact, that do business in Tennessee, that are licensed in Tennessee, because that is important. Then you have a contingent beneficiary. That means that if monies are not, all the monies are not spent for this particular person with whom you're raising the money for, then the contingent beneficiary will be the person who will reap the benefit of those dollars. You're not only protecting the individuals, but you are protecting the public who have chosen to give you money to address an issue that is out there. That issue is you have a family with a catastrophic illness, and we want to help, but we want those dollars to go where they are supposed to go. So we're looking at accountability, and we're looking at doing a service for individuals.
You know, from your perspective in the Tennessee General Assembly, looking over the entire state of Tennessee, do you find that there are a large number of people trying to defraud the healthcare system through that method?
Well, when you look at the healthcare system, well, you're looking at a whole conglomerate of things, where you're looking at nursing homes, you're looking at residential homes, you're looking at other kind of issues such as, you know, the doctors come into play, hospitals, and etc. I really can't adequately address that without looking at everything in that particular arena to see how much has been charged individuals and whether or not this was justified and that sort of thing. But I would like to say that in addressing the continued addressing of the healthcare issue, I put in place what we call the Tennessee Resource Mothers Program. And as you know, that Tennessee is one of the states that has a high rate of infant mortality and high rate of babies being born with serious illnesses. So what the Tennessee Resource Mothers Program does is to seek out young teenagers who are pregnant, and you go to them. Now, the resource mother is an individual who has been trained.
This is an individual who is probably paid
and trained to go out and look within their particular area to find those individuals, see that they get adequate and early health care, to talk to them about drug prevention during pregnancy, to make sure that they keep up with their appointments, and after the baby is born, then the follow-through takes place. We don't just turn them loose, we follow up to make sure that the baby has the care. And with this sort of thing, with drugs and etc., you've had so many alcohol fetus syndrome babies born, you had babies born that were AIDS baby, and that has cost the taxpayers tremendous amount of money. So when you go out into the community to try to alleviate those kinds of problems, then you have done a service, not only for the newborn, but for the taxpayers as well.
And certainly a service for the taxpayer as well as the newborn and as well as the mother.
certainly.
Now, how widespread is this program? Because it seems to me that that's a program with tremendous potential to do a lot of good things, and you could employ a large number of resource mothers, and that could really. How large is this program?
Now, in your urban areas, you do have good access to health care. The Tennessee Resource Mothers So Forth program has been placed into those rural areas where the access is not there, where persons who live out from hospitals and etc. can get the kind of service that they need. So far, we have 3 counties, and they all are up in the East Tennessee area who are being serviced by the Tennessee Resource Mothers program. And while we're talking about health care, I need to really say something about the welfare reform package. And of course, that welfare reform had to do with jobs, which is jobs, opportunity-based skills. And what you do is you set up programs to make sure that individuals who are on AFDC, which is Aid to Family with Dependent Children, would be trained into valuable job areas. What I have done to make sure that the people I represent are into job areas that are going to be valuable 2 years from now, 3 years from now, and those areas that are money-paying areas where they would not have to go back on public assistance.
If a job fails.
If a job fails, or if they train for a job that's going to be obsolete within a few years, and that's important too. If we're going to train individuals, we're going to use our tax dollars to do something about welfare, then we ought to do it right. So we have purchased a class, and the class has 23 AFD recipients in them. They are being trained now for the LPN program. From the LPN program, they can always opt to go into an RN, or they can opt to go into other technical areas that pay good money. And I think that that's important. If we're going to train, let's train for jobs that will pay individuals the kind of money that they need, where they will not go back on AFDC because of the failure of the job, or the money is not there to support a family. As you know, that trying to pay bills and trying to pay house rent and etc., and with a number of children, it takes the dollar to do that. And with that kind of program, then you know